el show del Dr. Roy Aranda, donde abordaremos temas sobre separación niños de padres, casos de violencia, traumas con los indocumentados, cómo resistir ante tiempos de pandemias. Llámanos en vivo al 1-888-900-2811, extensión 6, y haz tus propias preguntas al aire. ¡Comenzamos!
Buenas noches, queridos televidentes. Siempre digo la misma cosa, el famosísimo Tribuna TV. Welcome. Thank you for being with us and for joining us today. Today is May 20. Hoy es mayo 20. Tenemos otro show. We have another show with two guests. One of them you're very familiar with. He's been a guest previously, and he's my consultant, Dr. Peter Canaris. And I have a new specialist, another expert who I've been privileged to know probably just this year. It's been fairly recent, but he's all over the place. I mean, New York State Psychological Association, he's involved in so many different activities that he's really, I've come very much to admire him. So we have a show today, tenemos un show hoy, dedicado, it's dedicated to the elderly, to older people. Los ancianos, los viejitos, la gente de edad, los efectos de la pandemia, how the pandemic has affected this population. It's a population that already is challenged. I mean, there are already many challenges associated with aging, and the last thing that you needed is to have a pandemic for 15 months now, making matters all the more worse. So this is really the purpose of our show for today. With my guest, Dr. Canaris and Dr. Mitchell-Slutsky, we will be talking about several issues affecting elderly people. Estaremos hablando de muchos de los problemas de los ancianos and offering what we hope will be good takeaways, suggestions, and recommendations that you can put to use and to implement. As always, I let you know that the show is being recorded live right now on YouTube, and by tomorrow there will be a recording on not only YouTube but Facebook and Tribuna TV's website, as well as Vimeo and other electronic platforms. I encourage the viewers, sugiero que si desean que saquen fotos, please feel free to take photos of the slides. We don't have too many slides today, but there's enough slides with enough information that you may want to take photos or wait until you can have access to the recording and take screenshots so that you can digest some of the information from those slides. And of course, you always are welcome to contact me, Dr. Canaris, and in this case, Dr. Mitchell-Slutsky, and we have several references and resources for you that you can avail yourself at the end of the show. I'm here today. We're using a new platform for the guests, Zoom. We've had problems with Skype before. I'm sure that the viewers will realize that the last time we had a show, it cut off a lot. And thanks to Oscar. Oscar is my producer. Oscar, saludos al público. That's his warm hello greeting. We are stylishly sitting 15 feet apart. I will mention that I did take the Pfizer vaccine. I still believe that it's appropriate to wear masks for many reasons. We may or may not get into that. I'll share my logic. But certainly I'm very glad that in some ways it looks like the country's beginning to open up. We've been in this muck and mire, I don't know how else to say it, for about 15 months. It's like a combination of Groundhog Day, Twilight Zone, and La La Land, I guess. I'm not sure what else, It's incredible. It's really been an incredible existence. So without further ado, I'm going to ask Don Oscar, puede poner el primer slide. I'm going to just give you the title and the name of the show for you all to see. And then I will introduce the guests, and then we'll get started. So the show today, as you can see, is let me go to the right screen. Okay, it's entitled "Older Adults: Challenges as We Emerge from a Pandemic World," and my consultant and guest, Dr. Peter Canaris and Mitchell R. Slutsky. This is as part of the introduction, after an unprecedented year of isolation, like I've mentioned, 15 months. Trauma, loss, older adults have been the group most impacted by COVID-19 pandemic. As we move forward in the reopening process, which we're beginning to see now, more challenges remain, especially for this sector of the population. Unfortunately, this population is subject to a fair amount of abuse. We're going to talk briefly about it. I'll discuss just briefly the forms of abuse and some of the numbers for you to see, but it's highly underreported. This show, we've done domestic violence presentations and programs before, and we've talked about how victims of domestic violence tend to be underrepresented because they're afraid. They don't have somebody speaking out for them, and they're afraid to talk out for them because the repercussions can be horrific if they say something. Abuse. So Dr. Peter Canaris, Dr. Mitchell Slutsky, and I were going to discuss the impact of COVID-19 to older adults as we focus on the path towards assisting this vulnerable population in reopening as we go forward towards reopening. I'm dedicating this show to all viewers, seniors, and caretakers who have been affected by the devastating effects of this 15-month-long pandemic, in the hope that we may offer helpful educational resources. So, Oscar, por favor, el segundo slide. Y a lo mejor tendrás que moverlo para que se vea todo. So, here, my guest, you've met Dr. Peter Canaris before. He's top left, and Dr. Mitchell Slutsky is the top right. And just briefly, I'm going to sort of skim through it. Dr. Peter Canaris specializes in offering expert and comprehensive psychological services in the areas of general psychology and rehabilitation. He provides direct clinical services. He's done consulting to many healthcare facilities and staff, geriatric populations. He's worked with interdisciplinary treatment teams, offering consultation to the staff and to skilled nursing facilities, subacute rehabilitation centers as well. He's worked with the residents, with families, with the facility staff to see that they address all the needs of their residents. His background in systems psychotherapy, along with years of addressing problems with the systemic facility, so he's using that knowledge today in his conversation with us in his private practice. He's done extensive media work, and he's certainly done a lot of media work with me. This is the 53rd show, by the way. Let me tell the viewers that we're doing show number 53 today, and next week will be show number 54. There is a show next week, and in June I'm having 2 more shows. So Peter also has presented on the topic burnout in healthcare, and he's presented on sexuality and aging in the New York State Psychological Association. He's also been a guest here talking about sexuality, not just with aging, but in general. So thank you, Peter. And Dr. Mitchell Slutsky, I'm going to probably just go to first-name basis after this. He's a distinguished fellow of the New York State Psychological Association, former director of clinical and patient services for CHE Behavioral Health Services, an innovative treatment program to serve older adults in order to improve the quality of their life. Dr. Slutsky has presented internationally to organizations such as Alzheimer's Disease International, and the International Congress for Neuropsychoanalysis on such topics as the role of chronic dysregulation effect in accelerated aging and the use of implicit memory in the psychotherapeutic treatment in persons with cognitive impairment. If I get stuck a little bit, it's because the letters are small. I think it's a font 8, so I apologize. I'm in the category of an older an older person myself, so bear with me. My vision's been a little bit on the decline. So at any rate, so I apologize if I've misviewed some of the words. So also, he has a private practice in New York City. It's currently being done through telehealth. We've spoken a lot about doing it through telehealth, telephone or video conferencing. He earned his PhD in clinical psychology from the California School of Professional Psychology. In San Diego, he received postdoctoral training at NYU's postdoctoral programs in psychoanalysis. Welcome, both of you. Oscar, puedes sacar el slide. So, Peter, anything to add to that litany of wonderful things that I said about you?
No, Roy, only I'm glad to be here again to contribute to what really is a very important topic tonight. So I'm looking forward, and particularly with Mitchell joining us, I think his background and expertise will be a wonderful addition to this topic.
Mitchell, anything to add?
Well, I would say
did I kill too much?
That's okay. I probably should put it also into English. What I do, I do a lot of work with individuals and families and systems, just like Peter, in terms of working in a lot of its long-term care facilities, as well as working with individuals in the community who are more isolated and less able to access services. And this year, it's been interesting because it's been both a challenge for all of us, unique challenge for seniors we'll talk about later, but one of the positive sides is that Medicare has allowed for telehealth in the homes. That was never allowed before except with very limited circumstances. So I've had a chance over the past year to do more telehealth with people who couldn't have come to my office because of multiple reasons, and actually that is improving quality of care. So there's been a silver lining there of helping people who otherwise couldn't access health services actually more available during this year. So I just wanted to add that as another thing I've learned more this year because it was the first time we were able to do that.
Well, for the viewers, I did want to bring up that that Peter and Mitchell are both absolute experts in this field, both having worked in nursing homes. I have not. I have certainly worked with elderly patients, and I have, a fairly good practice, and many of my patients are, in fact, what I would refer to as being older at this point in time. And certainly vulnerable, because the patient population that I work with are people who have been, by and large, victims of some sort of accident. So they have physical injuries which exacerbate emotional. The emotional factors are exacerbated by the physical injuries and vice versa. So also. My older son, after he underwent surgery for the second time to the back, had to be hospitalized in a nursing facility that had the subacute rehabilitation. And he was there for about 3 months. And because of the pandemic, I couldn't visit him. I had to see him through a glass. And that's the way it was. With masks and with the glass very limited, it was horrible. I had no way of really knowing what he was doing or how he was doing or how he was progressing. And it has to be incredibly a feeling of despair and isolation. I know my son felt it, and I know I felt that towards him. So I can only imagine what people who are even if they have families, they're literally isolated. But what about people who have families or who don't have families, who nobody's contacting them? They're sort of like so alone. How can you feel? And I really want the viewers to try to open up their hearts and understand that, because when we see things in the news, We see numbers in the news about people infected by COVID-19, deaths due to COVID-19, people that lose their lives. We're seeing statistics. How different is it when you see a face and a name associated with that loss? This is a real human being. We had a show once, and Peter and I, we were talking about the empty chairs, and I'm delighted to say that I got that from our president. He was talking about in houses we have empty chairs. And it's true, people who have lost loved ones, there's empty chairs there, and those chairs will never be filled again. So I did want to give kudos to both of you and acknowledge your expertise in this area. So I'm going to be putting slides up for the viewers. I'll just quickly go over some aspects of the slide. Then I'm going to take the slide down and open it up for discussion for Mitchell and Peter to take it away. There's it's a fair amount of material. It's impossible to cover everything in a show that lasts an hour and 10 minutes. But I think that what we're doing today is a good sampling of some of the problems, and hopefully that the viewers will have enough to take away that they on their own can learn more, become more educated, go to the resources, put some effort into finding out a little bit more about it themselves, and or contact us or other resources. So, Oscar, por favor, el siguiente slide.
Ready?
So just some background information here, and I have my guests to thank for some of the data here. Older adults represent approximately 20% of the population, and it's a growing population. Where do people who are 65 and older live? 93% are in the community. They may live alone or with family. 2% are living in independent living, which is a bit of a misnomer. They're in a facility where they're more or less independent in that facility. Assisted living or other supported care setting, and 4.5% are living in skilled nursing homes. Those who are living with limitations, in 2005, 56% of persons aged 80 or older reported a severe disability, and 25% of the 80-plus population reported needing assistance. For some of the patients that Peter and I work with who are victims of occupational injuries and or other injuries, those numbers obviously would be much higher. The percentage would be much higher. There'd be much greater limitations and much greater need. Puede sacar el slide. So I'm opening it up for discussion, please. Peter, Mitchell, take it away. Any particular things that you want to add from that particular slide?
Yeah, I'd like to talk about the updating them. The census, these came from the 2010 census, some even was 2005. We're going to get new data, and I think we're going to see a few things that have changed. One is, as Roy had mentioned, the population percent of elderly is higher, and the percent of people living with chronic disability is much higher now. But now we have a new unfortunate and tragic statistic to add to that, and that is the number of deaths of people who were elderly. People 65 and older were in the highest risk groups. 80 and over was about a 20% chance of dying from COVID if one got COVID. And in nursing homes in particular, we had some homes, again, the data is not entirely clear, but we're talking about not a small number. And some homes, the larger homes, we're talking about sometimes 100 deaths in the building. We're talking about more than a single unit's worth of loss. So there's been a tremendous loss in the nursing home communities in particular that's far different than the kind of problem we see in the community at large. So we want to talk about, some of you may have lost some loved ones as a result of this, as Roy was talking about, in a short-term setting. It's still very frightening, but to make it real, these are people who, this was lose their home. And they spent a year with those who have survived, which is most, thank God, but have lost roommates, have lost friends, have lost many people around them, and now they're survivors in a nursing home. And I think it's important to look at what that's like for them. And now, finally, life is starting to come back, get out of one's room, eat together rather than in one's room, attend recreation. Things are starting to come back at normal, but it'll never be the same, especially for people who've gone through what they've gone through. It was quite a dramatic. We talk about a group being decimated. That's 10% lost. In many homes, you had 20% lost. It was a very difficult time that we're just coming out of, with vaccination especially. Things are finally starting to change. But there was a real trauma that anybody who's been in long-term care setting has undergone this past year.
I think there's a bit of a paradox, because on the one hand, we've been seeing how science and medical science and medical treatment has prolonged life and is extending life and is helping to keep people with illnesses that were with a higher or younger mortality rate alive longer. I'm not going to talk about the quality of life right now, but I'm talking about just the fact that the science has resulted in people being able to live longer. But because of the pandemic, where they're isolated, they're not necessarily getting the treatment that they need, they're neglecting it, or caretakers are neglecting it, you're seeing increased mortality because of the pandemic. So it's a bit of this paradox. You know, and I'm not sure what's going to happen to the age now of, you know, in terms of our statistics now. I think it's been in the mid-60s, but I'm not sure where that's going at this point in time. And it's historically been higher for females. You know, the life expectancy has been longer. But I'm not sure what the data will show now about the life expectancy.
Yeah, it's unclear. I'm sorry, go ahead.
Yeah, no, just picking up on a point that Mitchell was making. You know, in my experience, you know, consulting in skilled nursing homes and healthcare facilities, you know, you'd be very often counseling a resident and being in their room. And it's also very common that the room would be shared by another resident. There would be roommates. And I can recall the devastation of people that I would talk with when a roommate is wheeled out of the room, is deceased. And the great loss, the great devastation that's experienced from that. And again, to what Mitchell was pointing out, to think of as difficult as that is during the pandemic, with the numbers of people lost within the facility, just try to imagine being there. And that's your home, and that's where you're living, and around you is this tremendous loss, and there's also at the same time this isolation in an effort to try to contain the virus. So the trauma and the psychological impact of that is profound, and that will be something I think that we'll be dealing with for quite some time, just from residents who live in skilled nursing facilities or assisted living facilities, and I think that's a different phenomena from folks that live in the community.
And around the people who are very sick, you have caretakers who look like robots because you can't see their faces, and it hurts them. The caretakers are dying to try to reach out and are the persons who are the ones to last be of comfort, and they're not able. You know, you don't see a face, you can't touch skin, you can't touch, and it's the last thing that many of these people, you know, I don't want to get into statistics. We know that it's about pushing 600,000 by now. Obviously, it's horrific, and it's been horrific for the caretakers too. Mitchell, you were going to add something? Or?
One more very important issue here, because we talk about 20% of people who contracted COVID died in nursing homes. That doesn't mean 20% of the nursing home, because not everybody got COVID. But there's a real interesting question. Peter was talking about there's roommates dying. What we have also in nursing homes right now is survivor's guilt. All these other people died. Why did I survive? So that's one more dimension to bring on a very complex loss that we're talking about specific to the nursing home population that we're just going to be learning more about over time, the long-term effects. It's never really happened before in quite this way. There's never been this large population that old with a disease that particularly affects the elderly in a place where it was too, unfortunately, easy for this to spread, because unlike many other individuals during the pandemic, were unable to self-isolate, had to be in a group setting where it was an airborne disease. It just spread from room to room, even with the best of infection control. And in the very beginning of the pandemic, there was no protective equipment or insufficient protective equipment. So most of the deaths we're talking about all happened in a period of 6 weeks, from middle of March through June. Just a phenomenal time. And the other piece for everybody was the hospitals were jammed. People didn't go for care. And then we're looking not just at nursing homes, but the whole community. And that also affected elderly in the community who wouldn't go for routine care, may have had treatments that were stalled, and even had cancer treatments or treatments for cardiac issues, weren't going to the hospital because of being afraid. So we have I believe both Peter and Roy talked about excess death independent of COVID also occurred. So we have a very complex situation. We could spend a whole more than an hour, long time on just nursing homes, but this probably is enough for the nursing home piece. We can move to that effect then on everybody else in the community, especially the elderly.
Let's take a look at the next slide, por favor, Oscar. I'm going to put up the next slide briefly and then just go over it quickly, and then we'll take it down. It's I did tell you that I wanted to talk about the specter of abuse. It's an area that's near and dear to me because in my professional work, I've worked a lot in the area of domestic violence and worked with victims of abuse and neglect. So it's something that I'm aware of and familiar with, and I did want to put it up there. Some of the types of abuse are not dissimilar from what we talked about, women who are victimized. And it's not just women. Obviously, men can be victimized, and children as well. But I did want to bring this to your attention. Centers for Disease Control, CDC, defines elder abuse as, and this is a quote, intentional act or failure to act by a caregiver or another person in a relationship involving an expectation of trust that causes or creates a serious risk of harm to an older adult. Abuse of older adults is common. Approximately 1 in 10 persons over the age of 60 has experienced some form of abuse. Some estimates range as high as 5 million older persons abused each year. In almost 60% of senior abuse and neglect incidents, the perpetrator is a family member. A son, a daughter, a daughter-in-law, son-in-law. So, or even a spouse. Perpetrators also include staff at nursing homes, assisted living, and other facilities. It's a silent problem in the sense that it's so heavily underreported. Estimates are that 1 in 24 cases may be reported. Probably not that dissimilar for women in domestic violence abuse cases who are silent and live at home and don't have any access or means of getting out or communicating outside of the relationship that they're in at the house. So these are the types of abuse. Again, the viewers who have been part of a program that I've done in the past on domestic violence will recognize this: physical, emotional, sexual, exploitation. By exploitation here, I mean that maybe the older person has a credit card or money or property. Next thing you know, that credit card is used or the money's depleted, or possessions are taken away or sold or given away. That's the exploitation that I'm talking about. Neglect is when, they need to go to a dentist, to a doctor, they need clothing, they need, food. You don't spend time taking care of them in that regard, being clean, bathing them. Do you know what it's like? My father, may he rest in peace, was about 96 years old when he passed. And I have to tell you, puede sacar a slide. He wasn't abused, but I'm just giving you an example. The last 2 years of his life, he was bedridden, bedpans. My sister, bless her, took care of him. And, she made arrangements to have caretakers come also. And he was difficult, Spaniard with the attitude problem. Spaniard with attitude problem. So he would have temper tantrums and don't leave me alone. What are you doing? Don't bother me. But again, you couldn't leave him marinating in his urine. He had to be cleaned. And this is something that you get bed sores, you get problems. So that's my point here. That when you have people who don't pay attention to them or don't take care of them or aren't concerned about them, they're going to have problems, and they're going to create infections, and they're going to have ulcerations from not moving and from having the skin ruptured by sitting in the same spot over and over again. So I don't really want to belabor this particular area too much, other than to recommend that the viewers, if you are aware of people who are in any way exposed to these kinds of abusive situations, it's up to you. It's up to you to try to reach out, take care of them. They're a very vulnerable population. On their own, they're not going to pick up an iPhone, and mostly because they're also having telecommunication and the big technological divide. You have the younger people here are tech savvy, and they can type 100 words a minute, and they can text God knows how quickly and cross streets without getting run over by cars while they're texting. God knows I would. So, but the older people, they can't do this. they barely know how to turn the phone on or off, let alone, look at a text or read the text. I have many patients. I have to sit there and remind them over and over and over again of appointments that they have forthcoming, because they don't think to look at their messages. They don't look at them. They don't know how to access them. So any other comments about this particular slide? Otherwise, we'll move on to the next slide.
Sure. I would say that the risk of abuse has certainly grown as a result of COVID, and so that's an important issue to add. But also, besides that, there's also self-abuse has gone much worse. Levels of particular risk for suicide, overdoses of substance abuse. So these are all other kinds of abuse that have all worsened. Domestic violence has worsened. It's been a tough time. Yeah. And we're looking at solutions for the rest of this talk, I think.
There's risk from ignorance.
Yeah,
there's risk from ignorance, like a person thinking that you can that using Vaseline is good for a burn. It's not. I mean, there's risks. You use the wrong medication, or you decide that a little bit of rubbing alcohol, you can sip it. I mean, there's risks people take.
Roy, a positive development of recent years is that the Center for Medicare and Medicaid in encouraging practitioners on what to look for and what to pay attention to with patients, whether it's mental health providers or physicians, one of the areas has been encouraging questioning about issues of abuse. So hopefully these days it's more likely that if you're interacting with a mental health professional, a psychologist or otherwise, and hopefully a physician as well, that there is some direct inquiry about questions being asked that could ferret out if there is an elder at risk, if there is a problem of abuse or neglect going on.
Or appointments being canceled unexpectedly, or the person not allowing the older person to talk, answering for the older person. You almost need to separate them. In fact, it's what like police do themselves when they have a potential perpetrator and victim. They have to separate them. Because otherwise there's an intimidation factor, and these are some of the telltale signs that you see. So to the viewers, if you are aware of it, have heart, have compassion, intervene in some way, offer some words of wisdom or advice. If you need to pick up the phone and ask questions or report, do what you have to do. Life is too precious that you can just let it slip away. There's no reason why an older person shouldn't have whatever remaining years of his or her life, that those years should not be glorious years. There's no reason why we cannot aspire to see to it that they have that for whatever time they have left. Let's look at the next slide, por favor, Oscar. So the impact of COVID-19, I'm going to read a little bit quickly and then take it down. Some of it we've already talked about, so maybe we can have a little bit more of a robust discussion afterwards. But these people are vulnerable to emotional trauma. Why not? They're isolated. They live home. They don't have access to running all over the place the way they did pre-pandemic. Prolonged isolation from friends or family. I spoke to a patient of mine today. I had a session with her, and she said to me that she is planning to see her aunt in the month of June, and that she hasn't seen her since before the pandemic. She hasn't seen her since before the pandemic, and she's like nervous about taking the trip and what's it going to be like, the traffic. There's a little bit of a phobia component there. But imagine, this is what she's experiencing, and she's mobile. She's mobile. She's able to work. She's able to get places. Fear of dying alone. I don't even want to think about that, because I know what my father went through, and I know what other people have had to live through, live with close people, what that experience was like. Social isolation, having access to limited support, technological limitations like I was mentioning, physical challenges. You need a wheelchair, you need a cane. A walker, you may be bedridden, you're mobility impaired. Sensory challenges, you may have problems with hearing, with vision, with sight, with other functions of your body. Cognitive memory challenges. We all have a bit of a slippage as we get older, and then, if you're isolated, you're home, you have limited contact with others. It's like, is it Tuesday? I don't know. Is it Wednesday? I don't know. Some of my patients don't know the difference between Monday through Friday or the weekend, because on the weekend they recognize that it's a weekend because they go to church. They have services on the weekend, and they don't have services Monday through Friday. So it's like they couldn't care less what day of the week it is. They're victims of discrimination. I can't even begin to tell you the looks that I've seen on the faces of people when you see somebody in a wheelchair. Oh, my God. Oh, I have to go into that elevator with that person. Oh, I have to wait for that person to back up, because when you get into an elevator, you have to back into it. So you're back into it so you can go out normal. I can't begin to tell you. And the snide remarks, I'll wait for the next elevator. Or they'll jump out of the elevator. And this is pre-pandemic, okay? So imagine pre-pandemic. I'm pretty sure that we're still seeing discrimination at this point in time. It's horrible. It's sad. We call it microaggressions, macroaggressions when it's worse. And it very obviously very, very offensive. And it's ageism, I'll leave it up to you if you want to get into a little bit more. I can be on a roll with this. Health warnings and precautions not followed by caretakers. They're not wearing masks. They're not masking. You have a home health attendant comes, doesn't wear the mask. You're supposed to be masked even in the house of the person you're taking care of. Maybe that's going to change now with the vaccination, but you have to abide by the precautions and the healthcare requirements. The increased mortality rates that both these gentlemen were talking about before in nursing homes, and not just nursing homes, but in general. Risk factors are compounded by COVID-19. It's all magnified. And the significant rise in number of elder abuse cases, like I mentioned before. Puede sacar a slide. Gentlemen, anything to add to some of this? I covered it all.
Covered it well. There's a lot more we can say, but yes, I think you hit all the major highlights there.
Yeah. I'm fond of saying how I believe that in many respects the pandemic has been an accelerator of so many of the issues that older adults already were experiencing. So it's almost like they're magnified, they're intensified, they're increased, whether it's social isolation, whether it's a loss of opportunity to engage in interests that people might have. A patient of mine who was involved with the Silver Sneakers program and would get out and go, and well, now that program for a time was shut down. And then, it came the next stage, which is a beginning of opening up. Do I go back? Do I take that risk? Do I take that chance? So now you're dealing with the anxiety related to going back out into the world again. We first living in our caves, affected us emotionally, but then we got a little bit used to that, and then it became now, okay, how do I face what I haven't done for over a year, and what risks are included in that? So I think those are some of the things that I've seen and I think about.
We're going to be talking a lot more about that next week when we get into the topic of post-traumatic growth during the pandemic. Finding a silver lining. So we're going to talk about the kinds of things that people have to maybe look forward to, and if not necessarily look forward to work towards looking forward to goals and objectives. And of course, you have to recognize that it's going to be a slow process. It's not going to be from one day to the next. If people might say, well, how long will this take? The answer is it'll take as long as it takes. I think that a trained professional and maybe a person who's a caretaker also realizing the behaviors of the person he or she is taking care of can appreciate when there's stalling, hesitation, excessive ambivalence, backing away. But putting aside, those kinds of on-purpose strategies to delay, I don't want to do this, where there's usually maybe a fear factor, a fear of failure, fear.
Roy, in addition, there's what I sometimes call the broken dream factor. And those, that's with retirees or people who are approaching retirement or still active and had a vision of how retirement was going to be. And I'm going to go to plays, and I'm going to go to ball games and concerts, and I'm going to travel, and I'm going to go see my family in Arizona, and I'm going to do all these things. And suddenly, all these venues are shut down. Travel's no longer possible in the same way. And so now we head toward a time where, well, there's opening up on some of these things. Do I still can I still reconnect with that dream? And how do I deal with the anxiety that I'm having about do I place myself in danger? What happens? So I think these are some of the things also that we'll be seeing from older adults in the community who are trying to reconnect with what's that dream going to look like.
Let me share spontaneously an experience that I had today. These spontaneous experiences, they come my way. I don't know what else to tell you. I don't look for them. They come my way, but I try to take advantage of them, and if and as relevant, I incorporate them into the show. But today, purely by chance, I have my lovely wife, Irma, who's Puerto Rican and a professional nurse. And she's retired, works, in some ways helps me at home. So I was preparing some toast and coffee, and unfortunately, I didn't look to see that the mug that I was using that has the part that you close, it was open. So I'm lugging a plate for me, a plate for her, a open coffee cup for me, and I put her mug between my left arm and left side of the body. So I'm leaning it like that, holding a mug and holding two plates, and I'm looking like this. And of course, making a movement, I didn't realize that the coffee cup was open. And out comes this scalding coffee all over my left forearm, and I'm telling you, I saw the stars. I literally saw the entire galaxy. And it was so painful, and I sat there watching it get red and wondering, I'm going to start blistering. And, I contacted you two guys because I was sitting here wondering, am I going to be left arm handicap doing the show, and do I need my left hand, for the phone or anything like that? What's going to happen? And sure enough, it turned really red. I showed it to you, and it turned really red. My wife is a nurse, and she was there, and she was able to treat it with a special ointment, not an ointment, a spray for burns, and I'm happy to say that it's much better. It's still painful. It almost feels like she colored it when she put the spray over it. But my point in bringing it up is this happened to me. And I'm a professional. And I speak Spanish, I speak English, I have access to computers, access to phones, and I've got a professional wife. What happens if you fall to the ground? And those commercials, I fall and I can't get up. And you have people looking at them and they say, oh God, what a boring commercial. Oh, what a stupid looking person. Oh, get over it already. Oh, drop dead. I don't see this anymore. Really? What happens when you have somebody who does get a burn and is alone and doesn't have the resources or doesn't speak English or doesn't have access to first aid ointment? What happens? So I wanted to share that with you guys because I know that both of you have had experiences in this.
Well, it's certainly one of the big challenges when people live alone and don't have access to all the resources that one would need to be able to get help easily available. It is just one of those other challenges that's already, what we're talking about is that everything that was real before the pandemic was magnified dramatically because it also became asking for help. Am I going to get COVID? If I call the ambulance, am I going going to go to the hospital? Am I going to be safe? So we had all these other things compounding what was already a challenge for older adults especially. Now, by the way, I want to add one more piece that I think is really important that we haven't covered yet. Is one thing that COVID also magnified over this year is the difference between people with financial resources and could shelter either with small groups or alone, but safely, and people who, because of financial and family reasons, whatever, are not able to shelter alone, are living with family who also had to work, are coming, their family, their children, grandchildren are coming back and bringing perhaps COVID with them because they've also had to work in the community. So we're looking at so many things that are already problems in our country, magnified, the various, all these problems just brought into greater focus over the past year.
Yeah.
The point that Mitchell is raising is to be underlined, is so important. I've had the experience of having patients who have been out there and contracted COVID, came back into the house, and subsequently an elder in the house passed from COVID in the hospital, going through the whole process. But earlier, Mitchell used the phrase survivor guilt, and imagine if you're working because you have to work, and you come back home, and now a mother or a father or an aunt contracts COVID and perishes. Can you imagine carrying that? And again, through no fault of your own, and you don't have to do anything wrong to feel survivor guilt. It just has to. It's circumstantial. And,
you lived,
and it affects you. Yes,
you lived.
You lived. Yes, yes.
And a lot of people, they that's what they experience. I had my son, who's he's like not in my age bracket at all, but after going back to his residence following the nursing home hospitalization stay for 3 months, he gets there and he finds out that one of the residents had died of COVID while there, and he's sitting there thinking, wow, could have been me, what happened? It's again, this empty chair, empty bed. It's like there's a hole. There's a hole, and there's a hole in your heart as a result of that. Gentlemen, let's take a look at the at the next slide, because I really want to put a lot of emphasis to the viewers here. This is like I think some of the most important points to take away is, what do you do with all of this? Given that you now have this background, what do you do about it? How can we make things better? Oscar, por favor, el número 6. So, the road to cope and overcome challenges. I'm just going to briefly mention some of these things, and Oscar will take the slide down, and I'm going to expect my two experts to just chime in and elaborate some of the details. Things like, what does resilience mean? What's post-traumatic growth? That's the third one there. Trying to reconnect and socializing with others. We have spoken about that on the show many times. We've talked about how I believe that the concept, the labeling social distancing is incorrect. It should be physical distancing. We should not be socially distanced. We should be physically distanced during a pandemic, and we should be socially more together. Not necessarily face-to-face for obvious reasons, but that doesn't mean that you can't pick up a phone or have Zoom or video chats or WhatsApp. I mean, there's many ways of maintaining social contact. It should not be social distancing. Exercising, we all need exercise. Don't overdo it. I'm not sure how to tell you don't overdo it. I mean, you have to be aware of what your limitations are, of what your aches and pains are. If you got arthritis, stuff like that. Clearly, you need to know yourself. And probably, I guess, the smart thing to do is start real slow if you're not sure, and slowly but surely progress and add. And probably also a good thing is to get some word from your primary care physician or physical therapist if you have one. Somebody that has background in this, just at least guiding you or telling you what to do. And there are many exercises that you can follow on apps, on the phone, or printing them out. Get medical and dental checkups. This applies to everybody, not just older people, but anyone who's been stuck at home and they've been avoiding the doctors. You need to take care of your health. You need to maintain proper nutrition. Volunteer. When we help others, we help ourselves. This is probably more directed to caregivers and to able-bodied older persons who are able to get out there and be active and are interested and stimulated and want to be able to do things. Expect that getting back to normal, it's going to be a challenge. It's not going to be tomorrow. All of a sudden, you stop wearing your mask tomorrow because the law says you don't have to, and so things are better. No, it's not going to happen that way. It's going to take time. Recognize warning signs when help is needed, and perhaps even realizing that if you yourself or family members or loved ones or peers are not able to provide that, or social service agencies or other agencies, you may need to seek professional help. There's many agencies that can offer assistance. They can do it in many ways by you logging in and reading up on it. There's even you can contact them. You can text them. They say, "What's your message?" They ask questions. You can leave your name, have a follow-up phone call. So there's plenty of stuff that can do. The last one I left there, seek legal help if needed. This is probably more for people who are having some problems either as a result of abuse, or there may be issues about inheritance or competence or capacity, and some family member may say, "Hey, I think that my loved one is being taken advantage of." So seek legal help if you have to. It doesn't necessarily have to be just because it's abuse, but it could be matters pertaining to competence. Somebody being capable of giving consent to undergo surgery, or giving consent to giving away aspects of an inheritance, of a will. So keep that in mind. Puede sacar el slide. So, gentlemen, further elaboration?
Yeah, I want to start with the issue with it's going to be hard. It's a lot of people, I think of it as this is a period where we're in a cocoon. We would have our set plan for the past 14 months where many didn't go outside. It felt safe to not be with other people. And all of a sudden, the rules are changing. It's now you can go outside without a mask. You can be even inside without a mask. Again, if you've been vaccinated. And that's the other question is, people who are not getting vaccinated, I personally would urge people get vaccinated. It appears very safe. The risks are minimal, and the risk of getting COVID obviously much larger. But even assuming you're vaccinated, all of a sudden we spent 15 months not being with other people, not doing things. It's not easy to turn that switch. Let's accept it's going to take time, and it's normal to be afraid all of a sudden to be with other people. Try it, stretch your comfort zone, takes time, but it's really important that you're not losing your mind, you're not crazy, you're normal if you're saying, I'm not sure how to socialize again. I haven't done it in a long time. So we'll take it slow, and that's normal. That's how we sort of become more comfortable with the reemergence to this new normal that used to be familiar and we've kind of forgotten about the past 15 months.
Well, even small things like walking. If you're in a small apartment or in a room, you rent a room in a house, and your walking is limited to that room or the apartment, you're going to have less of that problem if you're in a house and there's opportunity to move. If you're limited because of steps and the house has steps, you might not be able to go up or down steps. Thus, you find that you are, in fact, somewhat environmentally restricted. But certainly the moving and exercising is essential. You lose body mass, you lose muscle mass, you lose tissue. It's not healthy. The arthritis and changes in the body, they are accelerated. You're inactive. You're going to have a quicker wear and tear of your body. And then suddenly, because now we're hearing, okay, on such and such a date, it's okay not to wear masks if you're outdoors. You can go here if you're fully vaccinated. You can go to the beach, it's fine. Make sure you carry your card that says that you're vaccinated in case the vaccination police are out there and they stop you. And I'm saying that facetiously, because some people on news medias and shows that I'm watching are saying we're doing this with an honor system. To me, honor systems go out the window where safety is concerned. You cannot expect people who are working 8 hours a day in a business, and you have a stream of people coming in and out and in and out, and expect them that, oh yeah, these are, all my clients are abiding by the honor system. No, they're still potentially exposed to the virus. So I do agree, obviously, that it's certainly important. We have new tools. We've talked on previous shows on how things like wearing a mask, physical distancing, washing hands, making sure that we use Lysol to clean surfaces, the vaccination. These are all tools. If we don't use the tools, if we ignore the tools, or if we use the tools erratically, then it's our own behavior, or better yet, our own misbehavior, that prolongs our eventual recovery from COVID-19 that I don't think we're going to necessarily ever fully recover. Maybe like the flu, it'll be with us, but will we be able to deal with it? Yes, I do believe there will come a time that we will be able to live with it, and I don't think that some of the hard lessons that we've learned are necessarily bad. It's probably not a bad thing feeling that you have to shake hands with everybody you come across with, or kissing cheek to cheek, side to side. Maybe some of these touchings is not really that healthy. Healthier ways to eat, taking better care of yourself. So there's probably some good lessons that we've learned, and we will focus more on that next week. But I did want to bring that up here. Peter, anything to add to this?
Yeah, well, you've covered a lot of what's important, I think. But the image that Mitchell mentioned about it's not like flipping a switch on, I think that's very true. I think it's actually more like a dimmer switch, the one where you slide gradually forward until the light gets brighter. And I think that movement forward really can be determined by how you feel and how you feel most protected, and the steps that you take as gradually to come out of the cave, to re-enter a more active or a more fuller life. For instance, exercise was mentioned, and it's not a question of training for the Olympics, but maybe getting outside, especially in these months ahead now, where we're dealing with better weather and more light and warmer weather. Just walking maybe in an area where there's some nature. If you could see some grass or a tree or a flower, that lifts your spirit, and you're getting exercise at the same time. And if you need assistance in walking or devices to be used, don't be foolish. Make sure you have the kind of support that is necessary, that you can walk safely. Another area that was mentioned in terms of the getting back to medical checkups, dental checkups, for instance. A lot of people have dental anxiety to begin with, and particularly with the exposure during the pandemic, are reluctant. But in my experience, untreated dental problems can really correlate very highly with depression. You know, if you think of it, your mouth is affected, your ability to eat, it's easy to get depressed from something like that, let alone
your appearance,
let alone correlations to cardiac problems or lung issues. So get back to the medical treatment that is needed. You know, if you need help, video therapy is now available. You don't even have to leave your house for that. To make a phone call or a video call. We'll talk about resources, I'm sure, in a few minutes, but there's help out there that you don't even have to worry. How do I get to someone's office? I can talk from my living room if I need to. You know, so these are some of the things that occur to me that I think need to be considered.
Let me add 2 points. For anyone who has not walked a block, you're going out there, don't suddenly try to walk 10 blocks. If you have not walked a block, maybe walking half a block is a good way to start and then turn back. Don't forget, wherever you walk, you have to be able to walk back. Okay, so you really have to estimate that, and you might want to consider, adding incrementally, half a block and a half. It's got to be, you've got to feel it. If you're starting to feel dying pain, that's not a good sign. You cannot overdo it, and you have to appreciate what you have not done in 15 months. And
Roy, and walking safely, because, if you're walking in an area where there are rocks or broken sidewalk or pebbles or sticks, the worst thing you want to do while you're trying to take care of your body with exercise is to risk a fall where you wind up in a hospital. So again, watching the area where you do walk, and if you need any assistance, don't be reluctant to use a cane or a walker or whatever assistance is needed to walk safely.
I wanted to add one more point, because you were talking about using it's like a dimmer switch. So, it's a dimmer switch, but keep in mind that sometimes the dimmer switch can go backwards a little bit. It's not necessarily going to be always steady, positive progress. You may slip and slide a bit, and it doesn't mean you go back to square one. Just keep in mind that you may have ups and downs, and that's okay. That's natural. That's part of it. Tell yourself that it's natural and it's part of it, and try to pick up where you left off. Oscar here is giving me the ready to yank me off the air sign. So let's look at the last slide, which is the resources, and with that, after that, we'll wrap up. So on this slide, what I have done is I have provided, my name and phone number to the left. Peter is to the right. Mitchell Slutsky, you have his phone number and email, contact information. New York State Psychological Association, as I frequently recommended them before. They're there with an address, phone number, and website. The American Psychological Association below that. Suffolk County Psychological Association, which is my association living in Suffolk County, and Peter too. Beneath that, we have several resources that were provided thanks to Mitchell. I'm just going to very quickly, you have COVID-19 Project, County for the Aging, Nassau County Behavioral Health Hotlines, helplines. Please take a photograph of it. I'm not going to go over each one. Take a photograph of it, take a screenshot of it tomorrow. Oscar, ¿puedes sacar la línea? ¿Cuánto tiempo estamos llevando ya?
Hora 10.
Oh, we've gone pretty long, so I'm happy. Older people deserve all the time they can get, so I'm not sad about it. Any last parting comment, Peter and Mitchell, before we end? we're at a wrap-up. Any just last word of wisdom or parting comment?
Well, first of all, I want to thank you for having me on the show. It is a pleasure to be able to discuss this rather difficult thing. What I want to leave us with, I think you'll be talking about in future shows, is about this is also a time for renewal and resilience. What doesn't kill you often makes you stronger.
Absolutely.
You know, I got through this. I can get through more. We can start feeling more optimistic again, and that's a wonderful time that we have right now.
Absolutely.
Opportunity for that.
Peter?
We are in the spring. The summer's coming. Look for the sun. Let's get out and develop again a renewed sense of hope and optimism that things can get better. We can help each other, and there is help if we need it. And let's do that a little bit at a time.
Oscarcito?
Bueno, que todos estén bien, que se cuiden mucho.
Okay, he's offering everybody a couple of tamales. So I think my viewers know that I'm a glass half full type of a person. I tend to be optimistic, but cautious. I'm cautiously optimistic. I'm the type of person who will say that if you can't go in one direction, try to go in another direction. If it rains, you can't stop the rain, but you can, take an umbrella with you. There's plenty of things to do. I want to wish my viewers good health. I hope that the show brought you some good educational pieces of information that you can pursue. Please take care of one another. Take care of each other. Take care of your neighbors in the community. If you don't see them, reach out and make sure that we're all well. The show will be available tomorrow, recorded on FaceTime, on Tribuna TV, YouTube, Vimeo, and other electronic platforms. Next week, I will have a show with Dr. Peter Canaris. To all the viewers, thank you for your presence. To my guests, thank you for your wisdom. Oscar, muchas gracias por la plataforma de Zoom. I love the Zoom. It didn't crap out on us, pardon my French. Thank you, everybody. Be good, and I will see you next week. Buenas noches.